Well, that's weird. Why don't you just get into my eyeball or something? Okay, so I got to tell you. Whew. All right, John, I got an idea. So John has been doing my videos since the beginning of time about gynecomastia, and I think we should interview John. What do you think about that? So who's here? Trace, do me a favor. Can you grab this camera and let's do an interview for John, and I'll answer the questions, okay? Or I'll ask all these questions. You got it?
All right.
Are you rolling?
Over there.
Are you rolling? Oh wow! Go over here, Tracy. Let's get John. We can. Are we rolling? I hope we're rolling.
It's rolling.
Okay, so.
This is awkward.
I mean, well, it's okay. It's awkward, but it's kind of cool. So John has been my videographer for the AGC for quite some time, and we have literally millions and millions of hits on our videos, for which we are so lucky. And so the great thing about John is. He's been with us, and he's dealt with the issues that we've had to deal with. So therefore, I'd like to interview him and start off by saying, well, so you've been doing this for a long time, and what have you learned about gynecomastia?
Probably the biggest thing that I've learned is that it's almost just as much psychological as it is physical. There's a lot more, talking to these guys, you learn a lot more about what they go through mentally, and which is something you can't tell just by looking. You have to actually talk to people to know. Right.
So yeah. So I think John has been with me during the whole beginning, when it was just about the surgery and what we do with how do we kind of fix this area here. But then it's really our focus has evolved into the real problem, which is in their head. And John has really been knee deep in helping to open up these folks, and we do a really good job of opening them up as well. So what about the treatment of gynecomastia? Do you think it makes a difference?
Absolutely. Well, it makes, from what we can see in the video part of things, it makes a difference physically, which is very obvious, but then you start to see the other side of it as well, and they tend to get their confidence back, and they immediately are able to forget about certain clothes that they used to feel like they were forced to wear to cover up their problem, and their quality of life goes from a 1 to a 10. So
yeah, that's nice. Yeah, so that
it's a win-win.
It's a win-win situation. Yeah. Now, probably what would be cool. So you were with us early on when we were doing most of these treatments open. Open technique basically means where I had instruments in here. There was an incision over here. And I pulled out these huge masses. And then we turned over to the Vaser system, and we started doing Vaser as a trial. And we did about 50 some odd cases, and we came to the conclusion that it was absolutely revolutionary. So from your perspective, how has it changed the treatment?
Well, my perspective is a little bit different, because sort of the home run, the money shot, if you will, used to be pulling out this massive piece of meat that no longer exists. So when you first did the Vaser and I saw how small it was, I was like, well, this is not going to be as impressive from a video side of things, right? Because I thought the guys are going to be like,
disappointed?
All of Dr. Caridi's patients have really small cases and mine's big, right?
Right.
But what I realized is that this thing that you're using right now is actually taking a big mass and making it small, so it's easier to get out, less invasive. So yeah, at first I was like, wow, the guys always talk about the money shot, which is when this big piece of meat comes out, right?
Right,
it's not there anymore.
So the drama. So I mean, I think that the guys like the fact that you pull out this big thing, because you know that's was driving them nuts, and now
they want to see it.
They want to see it, right?
Even the one we did recently, where the guy wanted to hold it.
Yeah,
he
exactly.
wanted to hold it in his hand afterwards. So, but I think in the end they would much rather you use this and have a smaller incision and not have as big of a procedure, I guess.
Right. Well, no, but you used a nice term. He used the term less invasive, and I think that's a cool term. So I'm still doing a lot of what I used to do in essence, but I'm not in there with all these instrumentations, and I'm not really doing this complicated procedure anymore. And the great thing about the Vaser is it just shrinks everything down. So I could take, a pretty old big hamburger and shrink it down to like what are those little things what they serve at restaurants? Sliders, okay? So that's a good thing. And so we go from essentially a big old hamburger to a slider. So remember that it's still there, it's still real, but this thing can really shrink it down really nicely. And what that does is it eliminates the amount of dead space, and dead space is something that you got to use drains for, and it's a complicated area that can get fluid and blood in. So I don't have that huge dead space anymore, and the incision's even smaller than it was before. So for that reason, you're right, it's less invasive, it's safer, and it's more predictable. So that's a big deal. Any of you folks have questions for John? How about you, Brian? You got a question? Nothing? Nothing? Back? All right, so the rest of the staff has gotten mum on us, but we'll call it that. We're done.
Well, it's been a pleasure doing all your video work.
Hey, John, hands off to John, baby. There you go. Woo! John.
John on the camera.
Yeah, no more John.
People have you referred over here? Do you guys talk about it? Now that it's out there more.
I think that, I mean, I don't know if I've referred somebody particularly, no, probably not, but I mean, at the same time, this particular guy works out a lot. I don't work out that much, so if I ran with a bunch of guys that worked out, I would assume it would be much more prominent.
Well, he also has seen, like, for instance, John knows how many hits we're getting on these videos. I mean, literally on some of these videos, it's in the hundreds of thousands, and some it's even in the millions. So he sees how his work is shown all over the world. And the funny thing is, he knows that that's helping people. So, we're not putting these videos out for any more of a reason than we have a lot of fun with them. And people respond well, and they like the videos, so we make the videos.
The biggest thing for me was just seeing how intense and passionate these particular patients are with their research. I mean, having guys like, when I start to film them, they literally already know what we're about to do because they've watched so many videos. And that's kind of a neat thing, because I've never had a thing where I researched it that much. So if they research it that much, that it's a big part of their lives.
It's a huge part of their lives. And I can't tell you how many people have come to me say, Doc, I've watched every one of your videos. I don't even think I've watched every one of my videos. But I think that what's heartwarming for me is that if it helps you to seek out treatment for the gynecomastia, then that's a good thing. That's not a bad thing. And I think that, I tell people that information is power. I try to tell people that, what you see is what you get. We don't, necessarily stage this so that it looks good or you feel good about it. This is it. What you see is how we're doing it, and it's real time. And we do a ton of these, and we do them each and every day, and we have people from literally all over the world, which kind of makes it cool. I mean, you notice that. So, we get to meet people from, India and Saudi Arabia and Iceland and Finland and Russia and, they come from everywhere. South America, Canada, all over the globe. And so for that, we're actually, pretty grateful and happy about.
You mind if I jump back behind the camera?
Okay, so we got to give him, we got to get him back in there. All right.